Hello, everyone. We have a great guest with us today, Dr. Lynne Saddler, who is the District Director of the Northern Kentucky Health Department and who is really at the forefront of this battle in our community against the coronavirus. So, Dr. Saddler, we really want to say thank you for setting your time aside. I know you're working very, very long days and every day of the week, essentially. So, we want to just jump right in and get some questions answered that you deal with on a moment-by-moment basis. So, let's just talk about the impact of the community, and you deal with this, and we're talking with you daily, and you're updating us on those who are becoming infected. But can you tell us a little bit about what you're seeing today in Northern Kentucky with the impact of COVID-19? What do you see today on the street?
Sure. We are seeing a combination of things. We are seeing people who are continuing to do what we've asked them to do in terms of the preventive measures so that they don't get infected and that they don't infect other people if they are sick with COVID-19. So all of those things with social distancing and staying at home and washing their hands and all of those kinds of things, which are so important. And I'm so appreciative to all the people in Northern Kentucky who are doing that. We're also seeing some of the essential businesses that are open who are taking the appropriate measures to keep workers safe, which also keeps the public safe. And so that's another important piece of what we're seeing. Our enforcement efforts at enforcing the governor's executive orders for other businesses that have not been able to continue operating to this point. Those have quieted down for the most part, and I think those businesses are starting to think about what plans do they need to be thinking about moving forward as the governor looks at how to best and safely reopen Kentucky. So we also are monitoring cases of COVID-19 that occur in our 4 counties, Boone, Kenton, Campbell, and Grant County. And whenever we get a positive case, we do what's called a case investigation. We want to know where people have been, when did their symptoms start, who have they been around, if they have been working, where they work, because we need to work with them and work with their workplaces so that we can find the contacts of people who have had close contact who may have been exposed so that they can be in quarantine and monitor their symptoms. And that's called contact tracing. So that's another piece that we do because these efforts help stop the spread. And it's just another important piece of what we do on a daily basis.
And this is happening daily, and you're getting, because of the new cases that are coming in right now, we still see new cases every day. You then trace that information and then, of course, are trying to do whatever you can, I guess, to prevent the next level and next case. So maybe you can speak to that a bit as well on, what your mission as a health department in prevention.
Sure, absolutely. And a big piece of that prevention is protecting against health threats. And so when we have a case, and we find out who they have been around, who has had prolonged close contact with them, we then reach out to those people and we just let them know that you may have an exposure to someone with COVID-19, and here's what we need you to do, and that's called quarantine. And so people for 14 days after their last contact with someone who was infected has to stay at home, they have to stay away from other people, and they have to monitor themselves for symptoms like fever or cough or trouble breathing. And in some cases, we're seeing folks with COVID-19 having diarrhea. So, monitoring those symptoms, if they start having those symptoms, they have to call their healthcare provider and talk to them about whether or not they should be tested for COVID-19 and letting them know they've had an exposure. And it's super important because, if they become infected, then they would continue to stay at home. We would call that isolation until their symptoms improve and their fever goes away. They might need to have another test to make sure they're negative. But that stops the transmission to other people in the community, and that's what we're really trying to do. If they don't develop symptoms in 14 days, then they're good to go. And of course, we're telling all people in Northern Kentucky, stay home. Regardless of if you've been exposed or not, the safest place for you right now is at home and not congregating with other people.
And so speak to that a little bit. So right now, I think everybody's a little anxious. The weather's getting a little bit nicer, and our tendency is to want to be outside, be with our family and friends. But until a vaccine comes out or other treatments that are available, we're still living in this time where we've got to be ultra careful. Can you speak to what maybe as the whether governor in a day, weeks, whatever the time frame is that things become opening up? Maybe you can speak to, I've asked a lot of other private business owners and things of saying, what does it look like in your mind? And of course, I know that the governor makes the final call on this and directing the rest of us to do it. But what does that look like as we move forward and come out of just staying at home?
Sure. I think the important thing about being able to move forward is making sure that businesses have plans in place, as the governor has talked about, that address certain criteria, because in public health, we want businesses to be able to open and we want people to be able to go back to work. That is super important to us as well. We just need to make sure it's done in a safe manner so that workers can stay healthy and that if it's a public facing business, that the customers can stay healthy as well. And other than that, that's all we really care about in public health, as far as let's just be safe, let's do it in a prudent manner, and let's work together to make sure that everyone's going to be able to stay healthy as we move forward and some of these restrictions are loosened by the governor.
So maybe we go back to the other, just the day-to-day things you're dealing with new cases. The new cases come into you. You then have to take your team to evaluate how to dig in to see where they had their roots in dealing with that, because obviously people get sick. Some of them go to the hospital, and God knows we've lost some people. But in terms of the actual feeling, what's your greatest fear about this right now with COVID? Do you have a worry that when you go to bed at night and lay your head down, what's your greatest worry about this?
I think my greatest worry daily is that, and I know this has been a very grueling, grinding number of weeks for everyone on so many levels, with the kids being home and people being off from work and the worries that they have associated with that, and trying to make sure that they are doing what needs to be doing, that fear of getting ill. My biggest fear is people reach a point where they just say, I can't take it anymore. And they, start doing things that put themselves at risk, put their families at risk, put their neighbors at risk. And which is why every day I'm giving that message in our daily press release about we need to keep doing this. And so many people are doing so well and finding ways of coping with some of these issues. And it's just so important that we stay the course. We are on the right course. We know that these measures are effective.
And Doctor, a big topic is testing. We have gotten the message that there are not enough tests for every single person to get a test just because they wanted to walk up and get one. But can you kind of give us an update? Where are we with testing? Why should we do it? Why shouldn't everyone just get one when I have a cough or whatever? Why shouldn't we immediately be tested and go from there?
Sure. And as time has gone on, testing availability has been improving. It may not be where we all want it to be, but it is improving. And we are able to test the vast majority of people who truly need to be tested. And I know that people who have had symptoms, who've contacted their healthcare provider, have been told, I think it's COVID-19, but I don't think you need to be tested. You can just, ride it out at home. And that's perfectly appropriate, because people can still, if they feel like they're getting sicker and they're really getting into trouble, they can still go to the emergency room and be evaluated, and they will determine if you need to be tested. The priorities for being able to be tested have been expanding over time as more tests become available. We've always had priorities for healthcare workers and first responders, people in the at-risk categories, those categories where people who are more likely to have serious complications, people who are over 65, people who have chronic medical conditions, people who have compromised immune systems and such. And so, testing is available for those people. The problem with testing everyone is that if you are not having symptoms and you get tested and it tests negative, what have you really learned? It just means at that moment in time you were negative. Or if you were exposed and don't have symptoms and you want to be tested, if you test negative, that still does not tell us whether or not you are infected and you just haven't shown symptoms yet, because that test has to be able to detect the virus in your body. And so when early on, just before you start having symptoms, you may be infected, but you're not, the test may not show that you are infected. So we call those false positives or false negatives. And it's always hard to know, what is that telling you? So on the other hand, if you are having symptoms and your doctor says, I think it's COVID, and I don't think you need a test, getting the test isn't going to change what they tell you to do. They're still going to tell you, stay at home, stay away from other people, all of those kinds of instructions. So, we have to be thoughtful in our approach to using testing. We want to know if people are infected, particularly if they are very sick, because those are the people who are going to need healthcare resources. They'll need to be in the hospital, may need to be in the ICU, may need ventilators. And so we want to make sure that we have those people tested. We want to make sure that the people who are essential to caring for people, whether it's long-term care workers who are healthcare workers, the healthcare workers in the hospitals, and our first responders who we all need to be able to take care of us. And those folks have to be able to be tested as well.
And doctors, a lot of people have questions about, how does this work? Who makes policy? Who has to put it into place? And from the governor on down, can you walk us through that process of how that works in the Commonwealth?
Here in Kentucky, the governor sets policy. As we have seen, he has issued a number of executive orders regarding measures that have to be taken in the community to try to control the spread of COVID in our Commonwealth. And so when he sends those down, as part of those orders, it will say which agencies are responsible for implementing those orders or those policies, and taking action, and what our role is supposed to be. And a number of those, obviously, that have come down regarding COVID relate to public health and the work that we have to do, but it also points to who we should be working with in the community as partners. And a great example is the partnership between our healthcare systems and the local health department, which we've always had strong working relationships, but with this pandemic, they have become strengthened even more, because we work together. They're working with individual patients, and we are working with the individual patient in the context of the community where they work, who they live with, and trying to make sure we don't get spread of the disease in the community. And so it's a terrific partnership, and it's not just healthcare systems. We work with a lot of other community partners in terms of trying to stop the spread, and how can we do that together. And Northern Kentucky is terrific at partnerships. And so I think that's one of our big strengths here.
And I know that you've had a lot of questions, and it's always healthy to have discussions, disagreements, but in the end, we come together and keep the community healthy. So that's what we're all about, I think. And as we come out of this, and there's a lot of things we can talk about, and we'll definitely do another one of these conversations, hopefully in the next week with you, if that's okay. But I wonder, as we come out of this, well, a lot of great information you share with us. Do you have a sense of that things are on the upswing? That we're on the other end of this? Are we plateauing? Or should we feel good about where we are right now with this pandemic in Northern Kentucky?
I think we have done well on a number of fronts so far, and one of which, of course, is our deaths. One is, our numbers, I know to some people feel large. They're larger than I wish they were. But when we look at the data, we're looking at what makes up that data and how much of this is community spread and how much of this is the fact that we had clusters in certain facilities or certain workplaces, because that's different than just generalized community spread. And it helps us get a sense of, how are we doing with our preventive measures in Northern Kentucky? And, so we keep looking at not only our data, we look at projections for all of Kentucky that I know the governor talks about as well. And I think the fact that we took action early on is going to bode well for us in Northern Kentucky in terms of being in a position to move forward with upcoming phases.
Well, and I know there's a lot of additional things to talk about, but I so much appreciate your time today, and we wish you the best with you and your team. I want to say thank you on behalf of the whole region for everything you're doing.
Oh, thank you. Thank you for all that you're doing.